All right, let's get you to the latest now on the coronavirus. Here's what we're watching for you this morning. In Houston and in Harris County, we are closing in on 6,000 cases. And in the U.S., it's now topped 1 million confirmed cases. Two more states, Tennessee and Wisconsin, are set to ease their social distancing rules today. On Friday, restaurants, retail shops, malls, and churches will reopen, but they must follow certain safety guidelines. First, they can only operate under 25% or at 25% capacity. All employees should be trained in proper hygiene and disinfecting, and workers should be screened for symptoms every day. And if an employee contracts the virus, they cannot return to work until 3 days after they've recovered. For places of worship, seating must be spaced out. There should be at least 2 seats between each person, and every other row must be left empty. Chairs should be disinfected between every service, and hand sanitizer should be available for guests. Now, if phase 1 goes well, Governor Abbott says Texas will then move on to phase 2 on May 18th, and that will increase capacity to 50%.
All right, here are the day's other big stories, Steph, starting with follow-up questions surrounding reopening the state of Texas.
There's confusion over which businesses will reopen Friday. Governor Greg Abbott says he will be clarifying his executive order after questions came up in Montgomery County.
The order doesn't say these establishments should be closed. All it does is direct people away from these type of establishments.
President Trump orders meat processing plants to stay open. Nearly 24 have shut down because of the virus. Unions say the White House's decision puts lives at risk. There are now 1 million confirmed coronavirus cases nationwide, and now more Americans have died from COVID-19 than in the Vietnam War. But more states are relaxing stay-at-home orders. Experts say it could be too soon.
It could be a rebound to get us right back in the same boat that we were in a few weeks ago.
To go back or not? With businesses reopening, furloughed workers face a tough decision. An unemployment attorney says workers need to know unemployment money could be at risk if their old job is made available once again. Toll operations on Harris County roads resumed this morning. They were waived last month. Hands-free collection will remain in effect, so if you usually pay cash, drive through, then pay online. And those are the big stories on this Wednesday morning.
Could the coronavirus have ties to a rare childhood disease? Janelle Bluda connects the dots.
Doctors in Europe are warning about a rare illness they're finding in children that may be linked to coronavirus. So what is Kawasaki disease and how does it affect kids? Let's connect the dots. Doctors in Britain, Italy, and Spain sent a warning to fellow childhood illness specialists about a small but rising number of children becoming ill with a rare disorder. They reported a small rise in critically ill children who tested positive for COVID-19 who presented with symptoms of Kawasaki disease. That is a rare childhood illness that causes the walls of blood vessels to become inflamed. Symptoms include a high temperature that lasts for more than 5 days, rash, swollen glands, and red bloodshot eyes. It is treatable and not contagious, but if not caught early enough, can lead to serious heart problems. Scientists are still not clear what the link is between coronavirus and Kawasaki disease. So far, the CDC reports children diagnosed with COVID-19 typically have mild cases of the virus, but there have been deaths reported, so cases in children should be taken seriously. Connecting the dots, I'm Janelle Bluda for H-Town Rush.
Scientists learning more about the virus every day. Remember, for the latest on the coronavirus, you can always text the word FACTS to the number 713-526-1111, and we will send you information anytime you need it. Now,